10 years ago, GeaCom set out to develop the most advanced, most scientifically informed medical engagement solution. There were other companies attempting these sort of things, and over the years, our approach founded in science, in ethics, in standards that you can't find anywhere else, is the only one that has survived. Because it's the best. The invention and innovation and meaning behind what GeaCom does, our foundation, is what separates us from all others and has helped us collaborate with medical innovators around the globe to solve the long-standing challenges of inequity and inefficiency faced in the medical world through new methods, through proven methods, to ultimately bring something totally new to the market that has real meaning to everybody's health. And I'm going to share with you a little bit today about that technology and how it's available to adopt effectively into your practice now and to take your services to the next level for those primary concerns about safety, security, population coverage, and economics. The most beautiful vision can fall flat when employed on the wrong mechanism. So we started from the ground up, designed with human factors, security, and safety in mind. Interoperability and capabilities not available anywhere else. The perfect medical engagement system that meets FDA standards, that is safe, that is secure, that is North American made, that is supply chain secured, and that is purpose-built to integrate with your medical systems from the EMR to the staff to the workflows, ultimately to a technology platform unlike anything else available today. Entering with the pandemic and with population shifts and racial concerns, we realize we hit the target. We have a handheld system that kills bacteria and viruses on contact. We have an engagement headset that provides private engagements for those patients to openly share sensitive information that doesn't block staff out. Staff can tap the authority button and communicate privately, even in a group with this individual. We can also have those headsets turn out to group mode so you can have family members in portions of that patient engagements. It's so dynamic that it works in waiting rooms, in common areas, in private rooms, in transit, in ways that provide for the patient's security and privacy, as well as their need to include family and staff. And you can reliably know that this is not a vector, that this is not going to expose data, that this is going to be interoperable with your EMR, because that is purpose-built technology. If you have a beautiful vision, you need to run it on a beautiful platform. And that is where we started with Fraser Kitsune. When a medical system takes a patient in, conventionally, that patient's alone. That patient's waiting for service. That patient spends 90% of their time isolated. On this platform, that patient's immediately engaged. Here, a patient enters into your medical service. They are now provided Fraser. Quickly, it identifies their language, their culture, and guess what? They're engaged with somebody they know, trust, respect. And from the moment it engages with them, they're never alone. It is communicating with staff, the nurse, the doctor, support staff throughout their entire journey. You can engage your entire population for the first time equally. That means, in spite of how old or young, what race and culture and background, and even what language they speak, this platform will effectively engage everybody equally and more efficiently, and it opens up opportunities never before possible. Let's visit an inpatient system run with Fraser Kitsune and select any Fraser and log in to our secure login. And we'll immediately see the medical cockpit. This control center shows me every patient in the unit and exactly where they are in their care right now. We have patients who speak English, who speak Somali and Mandarin and Russian, and I know I can communicate with any of them. They're all at my fingertips right now. I can tap on a patient and I can initiate a message for that patient. Hey, I've just come on shift and I'll be visiting you soon, and I look forward to our conversation. And I can have a conversation with that patient personally, one-on-one and securely, even if they don't speak English. That is never before possible. Or I can initiate a video conference with a patient who's been waiting to see me as I came on shift. I can also invite other people to this conversation through this secure bridge feature on Fraser. Bring in another staff member, a pharmacist, or a hospitalist to consult with my patient. I can even call in family members to have a conversation with their loved one privately. Fraser sends an automatic invite to their portable device or their computer, and they're joining the conversation with their loved one. And with this interface, much of what I would do as a nurse or a physician can be managed through personal engagements using site engagements that are things such as consents or discharges, preset and personalized to the patient's age, language, literacy, culture, gender. I have these built in so that I am augmented by the best possible bedside manner through this platform so that the time together is the best it can be. But what's it like for the patient? Not only is it their portal to progress their care, to communicate with their staff, but they can also utilize Fraser to access entertainment, books and movies and TV shows in their own language, a la carte. So inside of your medical system, with Fraser Kitsune and the site method, your patient has journeyed from the door through the admission process, through sharing their complaints and moving into rooming and their consents without a myriad of point solutions, without ever being alone, and without ever having to be isolated because of language, culture, literacy, or race, and knowing that they've gotten the best possible care and building better relationships with the staff. And when they return, Fraser Kitsune will remember them and pick up where they left off, reintroduce them to staff, and the experience will be again less expensive, more effective, with best possible bedside manner, and a whole new experience of healthcare that at the end of the day ensures civil rights, ensures equity across populations, ensures top of licensure performance from staff, ensures process adherence. It opens opportunities. But how do you know our solutions work? In this journey, there are no shortcuts. You don't have it because you think you have it. You need to test. You need to test in some of the most challenging environments and the most compelling use cases. And this has taken GeaCom around the globe. We've used this on 5 continents and tested in World Health Organizations, refugee camps, military applications. We have tested, retested, proven, and achieved our goals. And because of this, you can know when you put this in a patient's hands, you're giving them the best the world has to offer. That is the difference when you use Fraser Kitsune and the site method. That is modernized healthcare.